Hey everyone, welcome and thank you for joining us here today. So I've got myself, Shaun, Brewster and Bodine, Ledden, having a chat about a topic that we think might be of interest to a lot of people, particularly those practitioners who have been out in the industry for a little while and are maybe feeling a little stale or even maybe a little burnt out. But it's one of those things that we often chat to our students about and other practitioners that we know, and look, it's something we've got to be really careful of, right?
Yeah, definitely. I think there's sort of this understanding going into the industry that manual therapy has a huge burnout rate. So I think that's there's certainly a component of it. But someone like yourself that's been in the industry for well over 20 years. So it's certainly an industry that you can stay in for a long period of time and be really quite successful in.
Yeah, I think there's people that will be in an industry for a long time. There'll be others that will move on for very valid reasons. It's not always burnout. Yeah, you're right. I know when I was studying, the figures that were getting thrown around, on average, people would stay for about 7 years. And I thought, well, that's about double the amount of time I'm studying for, at least in my initial qualification. So that's not real good maths. When you look at it, I thought I want to be around for longer than seven. And so you really have to think about what can you do to be able to stay the course both physically but mentally want to be there. Like that's a big thing too. I think a lot of people, you can be physically strong and robust and be able to withstand the load that your body's put under, but it's another thing to be mentally on your game and then mentally wanting to be there every day of the week or how often you're treating.
Yeah, 100%. It's like any job, really. When you look at job satisfaction, enjoyment, if you're not enjoying any job, then yeah, you're probably going to have a pretty high burnout rate, regardless of where you're working and what you're doing. So if you're not enjoying your job, you're not treating patients that you want to treat, you're not progressing your education, your understanding, your experience within an area, then yeah, you'll probably get a little bit bored and feel like you want to change your career path. So I think it's really key to look at those factors that do contribute to burnout. And I think the first thing that comes to mind for most people is physical burnout. It's a
Yeah.
physically demanding job. There's lots of ways around that, but I think probably the one that has a far greater toll is increased levels of stress, emotional fatigue, that can then contribute to low mood and reduced enjoyment and all of that sort of stuff. So I think it's really a cycle. There's a lot of different factors that are associated, not purely just the physical. But I think, improving physical fitness can certainly have an effect on others. Same with improving just general enjoyment, your education, all of that sort of stuff.
Yeah, definitely. And I think specifically with our industry, we're talking about health practitioners working in private practice. You're in a situation, one of two situations all the time. You're in private practice by yourself, so it's just you in that room doing the work that you're doing with the patients. And yeah, you have that exchange, that those relationships that you build with the patients. But you may not necessarily have that same collegial kind of peer group relationship environment that you might have if you work in a clinic with, say, other practitioners. And so the stress of working by yourself, it might be perfect for some people. It might be their happy place, just doing their own thing. But for others, it can be quite lonely, and then that wears you down as well. Conversely, the opposite of that is true, where you've got someone who works in a big practice with other practitioners, and it might be a situation where the employer or the business model puts a lot of pressure on you. Like you're saying, it might build stress. So you might be under the pump to really sort of hammer through all these patients all day, every day. And that can take its toll. It can wear you down as well, even if you've got that network of people around you. So there's probably no perfect situation. I think there is, maybe that's not true. Maybe there's a perfect situation for you, an individual, and you've got to figure out what that is. Like personally, I think I've probably done my happiest time in clinical practice is when I'm in private practice. I like to do my own thing in my own environment. Luckily, I've got a big network of therapists that I know and connect with and communicate with on a regular basis. They might not be in the clinic with me, but I know they're right there. I can reach out to them. But not everyone has that. So you've got to figure out what is your happy space, and then being able to sort of maximize the benefits of that environment for you so that you don't get stale, you don't get burnt out. You don't get worn out.
Yeah, that's a great point. And I've been in both situations there as well, in a big clinic environment, which is awesome. You've got so many other the practitioners around to learn off, engage with, ask questions about. So you've really got that social connection, social interaction. But then I've also worked at clinics where you are pretty much by yourself, which, it really does tend to have a little bit more of a drain on you mentally and emotionally. So I think having that balance, but I can really understand, when a recent graduate comes out, just finished their studies and they go into their own private practice where they don't necessarily have a mentor, they don't have more experienced therapists around, they don't have that social engagement with other clinicians other than just with their patients. So you can really understand how that they might get to a point where unless they're actively going out and trying to further their education, then you sort of get to that plateau, which, if you're not being challenged, it really can, it really can take some enjoyment out of the job, where it just tends to, one day rolls into the next. It's the same treatment, you're looking at things the same way, it's the same types of clients that you're seeing, and it can really sort of have an effect on you physically, mentally, and emotionally.
Yeah, you're right. And anyone looking from the outside in would think that every day is different for us. Like you're seeing different people all the time, and you never know what presentation is going to walk through the door. And that's true. But you're right. If you do get kind of stuck in a bit of a rut of this is how I treat shoulders, when someone comes in with a headache, here's what I generally do for an assessment. You can become very repetitive in your processes, and that in itself is problematic for the whole burnout thing. But it's also problematic because you're not doing the best job for the patient. And so you're exactly right. You touched on that point of making sure that you're continuing to learn, attend courses, read books, watch vlogs, do all these things that are available to you. So much of it is free. You've only got to open Google and it's all right there. So continuing to refresh your brain with new information. It certainly worked for me. I know that's a big thing for you as well. Like, we talk about trying to find balance in your work and your life. Well, balance is one thing, but maybe just trying to maximize the things that work. And one thing that works, that we know works well, is learn new things, because it will create this level of curiosity and exploration in the way your brain works. And your mind will find new things in old problems. It'll find things that you get excited about that will produce greater outcomes for you. You'll get more excited about that. You get greater sense of achievement, reward from your work, and it snowballs from there.
And you said it right there, the reward, because there's certain ways to achieve that, those reward centers in your brain, or stimulate those reward centers. That could be exercise, it could be meditation, it could be reading a book, it could be learning. Learning will trigger those same reward centers in the brain that release those feel-good hormones. And I've experienced it just as much as you said, where you might go to a course, listen to an awesome podcast, whatever it is, and then you just can't wait to get back into clinic on that Monday, because now you've got this new way of looking at things, you've got that newfound enjoyment, but you're more curious. So you're more likely to start to explore and really enjoy your work more.
Yeah, you're right. And look, you've only got to look back at some of the other conversations we've had like this. Like you had Brad Hiskins on a little while ago, and he's someone who's been at this for 30 years, maybe more. I don't know. It's around the sort of 3-decade mark. And you talk to him, and you'll come up, I guess, against not very many more passionate people. Like, he loves his work, right? And he's intrigued by it, and he's humbled by it, and he learns new things, and he'll listen to people, and so that kind of mindset for someone who's been at anything for 3 decades, if you've still got that kind of opened, eyes wide open kind of view of what you're doing, that's the answer. Like, I'm sure Brad is going to do this until he drops. And that's not possible unless you've got a different kind of mindset than someone who goes to work to take home a paycheck. He's got a business to motivate him too. And like, I'm probably like him. I need something to build that's bigger than just what's happening in my clinical practice. So I've got to see patients because I love it, but I've also got to have something to build around that. And so for some people, to stay motivated and inspired by their work, they need a business to grow. They couldn't work for somebody else. They wouldn't fit in that space for very long, and that's absolutely fine. If you recognize that, then you should be trying to run a business, or at least trying to do something business-like outside of your work. And
Yeah,
so it's you've got to recognize what your path is, and it's not the same for every person.
definitely. And that's just that goal setting. So whatever that goal is, but you need to have a strategy to get there. And if it is that you are feeling, you know, overwhelmed, or you're stressed, or there's financial troubles, well, what's the strategy that's going to get you back to being comfortable? Because all of those things can affect levels of stress. And again, that cycle can repeat. So whatever it is, find a strategy, because I've been in the same situation, and it could be as simple as the last thing you want to do when you get home is exercise because you've had a long day and you feel stressed and tired. Well, yeah, it sort of seems counterintuitive, but you go have a run or a walk, or something to fill your tank back up, because the triggers of hormonal changes and the effects on the brain from doing something for yourself is really beneficial.
Yeah, I think another way to look at that too, and exactly what you're talking about, is if you view whatever you do, if you're trying to be great at it, if you view whatever you do as being like an athlete in that thing. So an athlete will dedicate a whole lot of time and effort to themselves into providing the right environment for themselves to excel, to recover, everything done in nutrition and sleeping and all those kind of things. A high-level athlete, their world exists around their goals. The goal is the center, and everything else revolves around that. And you don't have to be that, infinitely focused on your work to make this work. But if you look at it like, okay, if I want to be a great therapist and I want to be really good at this, but not just be good at it, but have some longevity in my career, do good work, but actually enjoy it as well, then I should treat this occupation of mine, this endeavor, this career, like I'm an athlete. So I'm going to, when I'm in the clinic room with my patients, that's me doing my sport. And so I need to build this muscle, this muscle between my ears. I'm going to learn, I'm going to do courses, I'm going to watch videos, I'm going to listen to podcasts, and I'm going to do all these things and learn the information to build that muscle. And then I need to recover appropriately. I've got to eat properly. I can't live off KFC with a quick dash down the road on my lunch break. I have to bring in appropriate nutrition. We've got to feed the body, because the body feeds the brain. And your body is also your tool. And you've got to sleep. You've got to recover. You've got to do all the things that you need to do. So just like you would tell your patients. And so the other upside to that, I guess, is you can use those living examples of what you're doing as an athlete therapist and apply that to your clinical work and say, look, here's what I do, and I know it works great for me. Oh, I used to try that particular method. It didn't work for me, but here's why. You've got some real life examples. You can relate to those athletic type populations, but also just anyone who's trying to be good at anything. It might be a 60-year-old woman who wants to be good at golf, and you go, well, okay, what's your recovery like after you walk around and do 18 holes? And they go, what do you mean? I just go home and sit down. That might be why you're getting stiff low back and hamstrings. And you've got to think about how you're performing on a daily basis. So I think treat your job, treat your occupation a little bit like it's a sport, and you're an athlete trying to excel at it.
Yeah, that was so well said. And you even think about, like you said, relating that back to your clinical setting, and we emphasize the biopsychosocial model. Well, I think, if we're the ones that are getting overtrained, let's say, from overtreating and stressed and emotionally run down, there's financial issues, there may be relationship, family issues, whatever it may be. Well, you got to think, well, what's in your cup, and how do you take things out of that cup, or how do you build yourself a bigger cup? Because it's all about improving our resilience, our enjoyment, to make us better at our job and make us enjoy it more.
Yeah, you're right. And the other thing that I think helps you fill that cup or make that cup bigger is like really working with people that light you up. I've been in clinical practice now for over 20 years, and I distinctly remember moments in time. I can still see them, and I know where I was when it happened, where I thought to myself, oh, you know what? I wonder what it would be like to to be an architect? Or I wonder, what if we like to join the police force? Or what if I went and joined the army or did something completely different? You know, it's just your brain goes off in these different directions. You think that looks like that would be an interesting job. Like I'd probably enjoy getting outside. I'd like to be a landscape gardener. Like, you know, these different things. And you start to wonder, what if I was doing those other things? And there's this little voice in the back of my head that always just sort of said, if you can hang in there past this bit, there'll be something beyond it that's worth waiting for. And 100% of the time it was right. You know, you just got to get past those dips. So there'll be peaks and troughs, and the troughs were when you start looking at other things, and I've been there a number of times, and I'm so grateful that I didn't pull the pin and go off and do something else, because there was way more beyond the trough, and there continues to be more and more all the time. So I'm so grateful for that. I like it. This will be my industry forever. No one could pay me enough money to get out of it, so this is it. But you've got to ride through the troughs to get there, and there'll be more troughs to come. And I think one of the things that I've intentionally done it now, but I probably did it by accident early days, which made a big difference to that, was start being a little bit more selective about the kind of patients you treat. Now, you'll always, if you see 20, 30 people a week, whatever the number might be, there'll be a percentage of patients that come through the door that are fairly run-of-the-mill, fairly basic, that don't really inspire your clinical reasoning too much, that you can almost do, you know, provide a consultation for with your eyes shut. If you're not putting too much effort in, you could get it done. But if you can make a good percentage of your patient population the groups and demographics of people that you are really interested in or have an interest in. So, for example, for a big chunk of my career, I worked a lot with runners when I was deep into the running world. Like, running was my passion outside of the work that I did. And so when runners would come in, I knew exactly the psychology of what was going on in their head at the time. I could relate to what they were going through when they were injured, because I'd had almost all the running injuries myself. And I could help them through that process. And every person that walked in the door, I was right there with them, and they felt that. And that lit me up, it lit them up, and that's a great experience. So if you're into soccer, if you're into fishing, if you're into surfing, if you're into, it doesn't matter what it is, there will be a population of people that you'll be able to connect with better. And if you can provide a service for them, that's so much more rewarding than just going, all right, I'm open to everybody and anything. And you'll end up with a whole bunch of people that are presenting with it, maybe the same kind of thing all the time, or maybe the kind of things that you're not that interested in. You can't avoid treating the general population with general things, but I'm just saying, if you can target your marketing, target the way you present yourself and the kind of things that you're known for, to really speak to the population of people that you want to work with, that again is a huge motivating factor, because you're around the people that inspire you, and that even more importantly, maybe that you can inspire through your own experiences and things you've got to offer. I think that's really, really important too.
I couldn't agree more. Yeah, I mean, and the key there is identifying that and then making the change. Sometimes it's hard to make that change. But really stepping outside of your comfort zone. I mean, a lot of what you said there resonated with me. Sort of stuck in a bit of that rut, but I need to get out. I moved across the other side of the country, to make changes, and now I'm happier than ever. Like you said, it's something that I'll definitely be doing for the rest of my life. But yeah, you've got to make that change, and a strategy to do that is just really, if you go and sit by the beach and have a think about things that you don't like, and you need to put a strategy in to make that change. Otherwise, that will just keep weighing you down, wearing you out, and that can lead to burnout.
Yeah, you're right. And look, I've had this same conversation with a number of students and graduates and people I've mentored over the years. Like, I'm just treating general population for general problems, and I want to get into this particular niche. How do I switch to that? Because every person that walks through the door just expects for me to just, jump out, they get undressed, lay on the table, I do my thing, and then they leave. How do I break that cycle of what I've been attracting and the kind of treatment that I've been giving to make it a little bit more dynamic or interesting or more suitable? And the answer is, you've got what you've got because it's your fault. Like, you attracted that, you built that, and you got to own it. I used to treat like that too. It was very passive. Patients coming through the door, just general lower back pain, neck pain. Nothing wrong with that. Like, that's still a great population of people to work with. But if you want to get a little bit more active with your treatment. If you want to work with athletic populations, or if you want to work with really specific musculoskeletal problems or neurological problems, whatever it might be, then you've got to start teaching your patients that that's what you do. And it might be that one day you just click your fingers and go, right, enough's enough, I'm now changing to this new model. Or you can just start to slowly drip feed it in, and what will happen is sort of a Darwinian natural selection kind of thing, that the patients who don't really fit or like your new model will gradually fade away, and they'll find someone that suits them better. And the ones that do and gravitate to that kind of approach will stay, and they'll tell their friends. And so it doesn't have to be an overnight thing. It can be a gradual thing, but you have to make the decision. I think you have to recognize the fact that whatever kind of patient population and treatment style and expectations that you've got within your clinical practice, you built that. Like, you started it, you perpetuated it, it's yours, and only you can change that. It's a hard pill to swallow, but at the moment you recognize that you can actually do something about it.
Definitely. And if you are in an environment where you are a sole trader, don't have much interaction with other therapists, social media, try to reach out. There's so many options to start to network with other clinicians, seek out a mentor, whether it's just to get some advice, bounce some ideas off, have that social interaction where you can talk about clinic and they'll actually understand what you're talking about. So I think that can be a nice way to start as well.
Yeah, it's such a big boost to this whole avoiding burnout thing, is just become part of a community. And I don't just mean, okay, join a Facebook group that talks about your modality. That's something that's useful. But there's a whole lot of negativity that goes on social media. There's a whole lot of just people calling each other out on their ideas. And look, that's part and parcel of being part of a profession, part of a kind of a community. But volunteer at your at local events. Go and donate your time to your association. Go to conferences, invest some money, go to a conference, and you'll think, oh, that doesn't sound very interesting. But you go to a conference and it won't be about what presentations happened in front of your eyes. It'll be about the conversations you had at the lunch break and the social event that happened the night after, and the people that you're talking to at the airport that you recognize from the conference. And those networks are incredible, and they last a lifetime. So actually put yourself out there. You might have to do these things by yourself, but you very quickly find that if you're open, you'll become part of a network of people that you can go to anywhere in Australia and you'll have friends. You'll have a community of people that you can connect with, and you can't put a dollar price on that. So that's going to be a huge boost to you not getting burnt out, is recognizing that there's people you can speak to, people you can bounce ideas off. And it might be that day when you're in the bottom of that dip, in that trough, and you put a phone call through to someone, you go, Bo, look, I don't know if you've ever been through this before, but I'm feeling like changing course at the moment and doing something else. Have you ever been here? And you go, yeah, I'm there right now. Here's why. And you go, that's what's happening with me. And then you bounce some ideas, and next thing you're both off to the next bit. So, those connections, those community and social networks within your industry, where you, like you said, you can talk shop, and there's a level of understanding and appreciation and empathy for one another. Can't recommend that enough.
Yeah, and it really is a great industry to be a part of. But, surround yourself with people who challenge you as well. So you can be fairly selective in who you surround yourself with, because if someone's challenging you, that you're going to rise up to that standard. So I think that's a big part of it.
Try to be the dumbest person in every room. Don't act dumb, but find smart rooms. Find a group of people who are above your level and hang out with them, because you're like you just said, they'll pull you up. If you take your knowledge and your skill and you go, I want to be, the demigod of manual therapy or whatever it is that you want to be, and you go and just hang out with people who are at a lower level, not a lower level of knowledge and skill, then they've got nothing to offer you, and you're not going to rise up with them. So you want to be that, you want to be the boat sailing into a higher tide, have it lifted up.
Yeah. I want to be the best player in the worst team.
No, that's right. That doesn't win premiership medals, does it? No, I think, there's some good points there. Look, I just, this time we're going through right now too with the whole pandemic and stuff, I've lost count of conversations that I've had with people, or seen conversations online of people getting like really downtrodden with it all and feeling like it's all hopeless, particularly in states like the one I'm in, where so many of us have been considered non-essential, even though our patients are crying out for us and saying, look, I need your treatment, keeps me going, it manages this problem, that problem, and no doctor or maybe even physio or osteo or whatever, but will be able to help me like you have, because we've built that relationship over time. And I can understand how people are feeling burnt out and worn out and tired and just frustrated with it all. And all I can say is it's just one of those dips. We were, some of the states in Australia, with the way things were categorised, we were dealt a not so good hand with the way things were managed. But at the same time, I look around and I see people who are stuck in that same situation who are excelling. They've used this time away from their practice to do other things, to build other avenues for their businesses, or they've gone, I'm going to step back and just refresh. Now, I'm not going to think about work for a little while. I'm going to take a bit of time off and invest that in my family. I'm going to do some home renovations. I'm going to build my body physically. I'm going to do all these other things. And so when they do get that green light to come back, they come back even better than they were before, because they've had a chance that you would never normally have. Like in the last 2 years, I've treated less people than I have ever have in my life. This is the longest period of time that I've ever gone without being able to treat people. And it was frustrating and difficult for a start, but then I realized, okay, maybe it's a unique opportunity, because once the doors open again and everyone's back to normal, maybe I'll be wishing that I could have a break. So let's take that opportunity. What else can I do with this time? And nothing is different in that approach other than your perspective. Nothing's different for me than it is for someone else. There might be different financial or social or family support situations or whatever, but the external environment is exactly the same, but your perspective definitely makes a big difference to your outcomes. And so, yeah, if you're in a crappy situation at the moment, I'm sorry to hear that, but you've got to think about, okay, how can I flip that around? What can I do to make this a win for me, so that when we come out the other side of it, I've used it rather than suffered under the weight of it.
Absolutely. Couldn't agree more.
Burnout, though, it's a big topic. We could
It
probably
is.
bang on about this forever. It's
Yeah.
I know you're like me. It frustrates you, and it makes you it wears you down to see other people suffering, when like anyone looks at us and they think these guys are highly motivated and love what they do, because we do love what we do, and it's
Yeah.
because we know that you've got to do all these things that we're talking about. Otherwise, you do get stale, and we've both been there.
I can say, honestly, the one thing that really drives me to keep going is education. I, am lucky in this environment that I get to have my head in a textbook and research papers, writing content and, educating others. So that just keeps me more motivated to keep going and learn more, which makes me love my job even more. So that I've found what works for me. It's really just about identifying, certain factors that fill your life up that will have an overflow effect into your job as well.
Yeah, absolutely. And you're a great example of this too, because you're someone, I think, like me to a degree, where you set big, ugly goals, like ridiculous goals, and you've shared some of those with me. And I won't say them out loud, but some of those goals, if you told anyone else, they'd probably like, are you serious? But you set that big goal that's almost unimaginable, and then you set yourself a timeline for that goal that is way longer than most people would have the patience for. And so it's not, oh no, I failed. Oh no, I failed. It's, I'm working towards a goal, and the end point of that goal is as far away as it needs to be, but my goal is big and ugly, and it will be, it's worth striving for.
Yeah. These things don't happen overnight, and they certainly don't fall in your lap.
No, nothing.
And if they do, it's because you put yourself in that position for it to fall in your lap. So, look, they do need to be big goals. Obviously, small goals to get you to that big goal, but set your sights high on something, and it'll happen eventually.
Absolutely. Yep. Bo, I think we've given people a few ideas here to work with. Thanks for
Yeah.
your thoughts on that one. We'll leave it there, guys. Just stick at it. Yeah, there's dips, there's peaks and troughs. And if you're in a trough at the moment, hang in a bit longer because there's a peak coming, and hopefully we'll see you all there. Cheers.
Cheers.